Do you know about GOLD?
Gold jewelry?
Not exactly.
Oh.
GOLD is an acronym for Global Initiative for Chronic Obstructive Lung Disease. There are many members around the world. A total of about 12 countries are involved in the network. The purpose of this is to raise awareness of COPD and improve prevention and treatment of COPD. So we'll look at my pocket guide, which let me get right here. And this is very useful to use for this type of lung disease. It was updated in 2015, so pretty recent.
So one of my family members has COPD and has trouble breathing. So how can gold help them?
So COPD, it stands for chronic obstructive pulmonary disease. It's a major cause of morbidity and mortality throughout the world. Much has been learned about COPD since GOLD has issued its first report. Treatment of COPD is now aimed at immediately relieving and reducing the impact of symptoms, as well as reducing the risk of future and adverse health events such as exacerbations. These dual goals emphasize the need for clinicians to maintain a focus or both the short-term and long-term impact of COPD on the patients. A framework for COPD management that matches individual assessment of the disease to these treatment objectives will better meet each patient needs.
So what exactly is COPD?
Well, COPD is an obstructive lung disease. It's a common, preventable, and treatable disease. It's characterized by persistent airflow limitation that is usually progressive and associated with an enhanced chronic inflammatory response in the airway, in the lung to noxious particle or gases. Exacerbations contribute to the overall severity in the individual patient. The definition does not use the terms chronic bronchitis and emphysema and excludes asthma. Symptoms of COPD include shortness of breath, chronic cough, chronic sputum production, so excessive mucus. Episodes of acute worsening of these symptoms, exacerbations often occur too. Spirometry is required to make a clinical diagnosis of COPD, so this is where we can see if they're air trapping, and the presence of post-bronchodilator FEP1 FEC percent less than 0.70 confirms the presence of persistent airflow limitation, and thus diagnosing a patient with COPD.
So what causes COPD?
Worldwide, the most commonly encountered risk for COPD is tobacco smoking. So that's going to be the number one thing. Is we're going to see a lot of people that smoke that get COPD. So outdoor, occupational, and indoor air pollution, the latter resulting from burning or biomass fuels, are other major COPD risk factors. Non-smokers may also develop COPD, surprisingly. The genetic risk factor that is best documented is a severe hereditary deficiency of alpha-1 antitrypsin. It's still being studied. It provides a model for how other genetic risk factors are thought to contribute to COPD. COPD risk is related to the total burden of inhaled particles a person encounters over their time. So tobacco smoke including cigarette, pipe, cigar, and other types of tobacco smoking popular in many countries, as well as environmental tobacco smoke. Indoor air pollution, it can be biomass fuel used for cooking, heating, in poorly ventilated dwellings, so a risk factor that particularly affects women in developing countries. Occupational dust and chemicals, vapors, irritants, fumes when the exposures are sufficiently intense or prolonged. Outdoor air pollution also contributes to the lungs' total burden of inhaled particles, although it appears to have relatively small effect in causing COPD. In addition, any factor that affects lung growth during gestation and childhood, low birth weight, respiratory infections, has the potential to increase an individual's risk of developing COPD. Yeah.
We talked about Mrs. Tubbs earlier. I wonder if she's ever smoked before in her past.
Well, earlier I mentioned that Mrs. Tubbs is well known to our department. She has been a patient here several times over the last few years. She is a heavy smoker. She has typically smoked 2 packs per day. and she's been doing so for 20 years. So which that gives her a 40 pack year history of smoking. So if you take the pack years and times it by the amount of years that she's been smoking, or if you times the packs that she smokes per day and then times it by the years that she's been smoking, that gives you pack years. So part of our departmental smoking cessation protocol is to identify all smokers and encourage them to quit. We've tried to counsel her about smoking cessation during each hospital visit, but she has not been very receptive to the idea. So since I am also the department's tobacco cessation counselor, I will be reviewing the 5 R's of motivational intervention with her today.
5 R's. I've heard about the 5 A's,
Yeah.
but not about the 5 A's of smoking intervention, but not about the 5 R's.
Okay. Well, the 5 R's are revealance, risk, reward, roadblocks, and repetition. Revealance is about encouraging the patient to quit smoking when they come in. Risk is just about identifying the potential risk factors that come with smoking tobacco. Reward is where I will ask the patient to identify potential benefits of stopping the tobacco use. So any positive outcomes, a healthier lifestyle, your car won't smell as bad, your clothes won't smell bad, just stuff like that. Just give them potential effects. And reward is where I will ask the patient to identify any potential benefits of, I'll just talk to you about that. So roadblock is the next one. I will ask the patient to identify barriers to quit smoking. So this is where I'll ask where anything they'll come across that might help them from getting to that point. And then repetition is just where every patient that comes in, we're going to repeat this every time that they visit our clinical setting, and it's just very important to keep repeating and seeing the outcome.
Hopefully that they'll catch on eventually.
Yeah. So if a patient desires to quit, I would like to try nicotine replacement therapy. And I can recommend several products such as nicotine gum, nicotine like drops that they can suck on, like kind of like a cough drop.
Oh,
They can just
okay.
put in their mouth.
Okay.
Yeah. And they also have a nasal spray. So there's many options that they have. They have a patch. I'm sure you know about that.
Mm-hmm.
They have nicotine tablets and a nicotine inhaler. So pretty much any device, it gives a patient a flexible option to choose whatever one they're most comfortable with. If a pharmacological agent is preferred, varenicline or nitropilline can be suggested.
Wow. Well, honestly, didn't realize that RTs
Yeah.
also provided smoking cessation counseling. I can't wait to observe the interaction with Mrs. Tubbs. Can I ask you another question?
Absolutely, I love answering questions, and I'm a teacher at heart. And I love being a respiratory therapist, and it makes my day to be able to share what I know with you.